So we have Rose, who's a breastfeeding peer counselor with WIC in Tulsa, doula, childbirth educator, and postpartum care provider. So welcome, Rose. And I know we've got several of our hospital friends on. Oh, yay, Angela just got on. So, well, we'll go ahead and get started. Our topic today is really life after baby-friendly designation. So we thought it would be helpful to hear from some of our currently designated baby-friendly hospitals and how things are going and maybe some of the challenges. So each of our hospitals were sent a little template of just a handful of slides to kind of give us some feedback and a picture of what's going on in their facilities currently. So, Angela, can you hear? I have everybody unmuted. Hello, Angela?
Yes.
Yes. Yay.
I couldn't get in there for some reason from my hospital phone, so here I am. I'm sorry.
Okay, no, that's fine. So are you ready if I put this on, and I'll just advance the slides. Let me do slideshow here. And I am going to move this out of the way. So hopefully, does that screen look good to everybody? Can see it in slideshow format. So Angela, if you want to introduce yourself.
My name is Angela Strickland, and I'm the clinical educator here at St. Anthony Hospital and one of our team leads for our baby-friendly designation project. Karen Blackburn is she's our lactation, and she will be signing on here in just a few minutes.
Okay. Do you want to wait? We don't, we just happen to have your slides first in our, if you want to wait till Karen gets on.
If you've got somebody else that's ready, that'd be ideal. We had something happening, and we needed a couple extra minutes, and I'm so sorry.
Sure. Yeah, so we've got Carrie on, and I know Carrie wasn't sure she could stay on the whole time. So Carrie, you want to start then with your slides?
Sure. I kind of exited out of it by accident. I can wing it.
Okay. So we'll put Carrie on the spot. So if you want to introduce yourself, Carrie.
Yes, my name is Carrie Rigsby. I work at Cherokee Nation Hastings Hospital. I was actually the baby-friendly project lead and have now switched roles into the nurse educator. So even though I'm still involved, I'm not there all the time seeing what their battles, but I hear about it a lot. So I'm kind of like the report person.
Right. So, well, I'm going to go ahead and, advance your slides. You just tell me when you want to move on to the next slide, so I'll let you take it from here.
Sure. First, and I don't know what slide you have up because mine's reloading, but our hospital, we deliver about 75 to 85 deliveries a month. Now, let me just say, and I think Mary's on here, she can correct me if I'm wrong, but September was 98. So our deliveries really blossomed. So there's been some changes there, which is good. We're not complaining, but it's just one of those things that you never know what to expect for sure.
Right.
The number of nursing staff, we have about 34 nurses and nurse aides that work with us. Our physicians, and I included our midwives, our peds, and our OB docs. So we have 18 of those. We have lactation counselors, and we have 4. But I need to make sure that that's understood. We have 1 in the clinic. We have 2 on the floor, but they work different rotations. So it's kind of like we don't have 4 on staff all the time. So that makes it kind of hit and miss, if you will. And we got our designation in July of 2015. So,
all right, so 2 years. 2 years to tell that. All right, so
our
we'll
successes,
talk about, yes.
Skin to Skin is ongoing. I think the nurses see a lot of positives with that, so that's something that was a pretty easy change. It doesn't require a lot. As a matter of fact, it helps them a lot just because they can put the baby there and not have to worry that the baby's getting cold or anything else. And rooming in is always a positive thing for staff and an easier thing to do. Our challenge is we got our designation in July, and we got a new computer system in August. So that's been
Who planned that?
Yeah, well, and the thing was, is we were trying to get our designation before the, implementation of the new system, which we did, but I don't think, and we knew it would be hard, we knew it would be different. I don't think we understood how hard and how different. It was just so many changes, and the data is all there, but where is it? It doesn't flow like it did before. Everything we had implemented to achieve our designation wasn't there. Our reminders of what to do on education for discharge just everything changed. So that's been a process. So initially, when we got into this new computer system, we just took a step back and said, let's just not overwhelm everyone. Let's just sit back. Hopefully they'll keep up what they're doing. And then all of a sudden you look up and no one's really doing what we worked so hard to achieve. And that's not really nursing's fault. It's just there was so much to take in. The next thing is maintaining breastfeeding support. And I put in my notes just for family and staff. I left that position, and so you have to keep a champion on that floor. And I say a champion, but I don't mean it in a bad way, but almost like someone to nag the staff to stay on board, to keep putting reminders out about how important these things are. One of the things that we've talked about, me and Mary, a lot, about PIs and how the staff needs to do these PIs, these chart reviews for this data collection so they can realize how important it is for that documentation to be there. And how when it's not, you kind of panic because then you wonder what happened, where did we fall out? So that's a big thing there. I think that's important and been a challenge for us. The other thing is old habits are still hard to break. In the past year, we've started recovering our own C-sections, which has been new for us. We've done all of this without adding a lot of new staff. So here we're doing different charting, we're recovering our C-sections. Sometimes it's just easier to give a mom a nipple shield or to just, whatever, just suffice until I can get my other stuff done. And it's just, again, it's not really anyone's fault. It's just you kind of go back to those old habits. I think the biggest thing I want to tell everyone is I hope that these challenges don't discourage you for trying to get this. I think that you can learn from our mistakes. You want to succeed, you want to get your designation, but remember, once you succeed in it, you have to maintain it. It's kind of like weight loss. You can, if you get it there, you have to keep it up. And it's just easy to let it fall by the wayside unless you have someone there constantly reminding to do those things.
Right. So what would you do differently then?
Differently, well, don't stop what you're doing after designation. Continue with your meetings with your committees. I know that's something that we kind of, again, let fall to the wayside. Stay on top of it. New staff, like even our providers, we're tribal facilities. Our providers sometimes come in and out. We have locums that are here for sometimes 2 weeks, as long as 3 months. Where do they fall into that education? They're really not here long enough, but yet they need to be on board with what we're doing. We're really good about getting our new staff into the baby-friendly training, but they've not been through what the older staff has been through as far as achieving this. So they're still kind of doing what they did at their previous job or just learning from whoever's mentoring them. And again, like I said, someone has to be that champion, not just to be that nag, like I said earlier. I don't mean that negative, but just for support. When someone comes in and says, a provider told this mom to give it a bottle, and how do I convince her? It's another person to say, this is what you tell her, or this is what you need to do. I would push for a lactation consultant, and this is something that was in our plan and was apparently in our budget, but we never pushed hard enough to get one, and I think that's key, having the expert there, not only for your moms. of all shifts and all, someone to call that's right there live. But for our staff, I think staff needs to go in, not just say the lactation consultant will be here in a minute. The staff needs to be there at the bedside, learning what that lactation consultant is teaching that mom, so the next time they'll be able to, do those things, and it won't be such a challenge. So that's kind of where we're at. I mean, we're still okay. We're still, these audits, once you get your designation, Baby Friendly sends you out yearly audits, and they're on the 10 steps. And that kind of makes you panic, because then you realize when you take those snapshots, wow, where did we fall out? Why are we doing this, or what happened here? So definitely that's something that's good that they've put into place.
Yeah, helps you keep track of what's going on. And
right. And again, we're supposed to be doing audits, but a lot of times it falls to the wayside because we're so busy. We're trying to do, as everyone is, more with less, more things, more patients, and it's just hard to balance it all out and do it all well. So it's everybody's battle, I'm sure.
Right. So one question I had for you, because I think under your successes, you said rooming in has been a success, yet sometimes that's one that we hear, is hard, or they get, they feel like, do you get very many requests from moms that want the baby to go to the nursery because they're too tired? What about that?
Not really, from what I'm hearing from staff. I mean, we'll have an occasional one, but I think the staff is really good about educating the mom, because the staff doesn't have time to take care of their baby, because our nursery is not open to, it is open for moms who need the nursery, but it's not just open for just all the time. So I think they really educate those moms and talk about how important it is that they do keep their babies with them. But in the same time, and we just discussed this when you came down and did some training for us, we need to make sure that moms are given a chance to let their baby go if they're having a hard time. Sometimes moms just need a break, and that's okay. One of the things we have to really watch is documentation of that. So, and that's where the new computer system kind of, we got to figure out what works best for the nursing. So.
Yeah, and I think one of the things we talked about was baby friendly is not 100%. So you're always going to have the occasional situation of, this mom, or she's heavily medicated, she doesn't have any support people. We always need to be safe. But when that starts to become every night or every day, we have babies, okay, now something is actually not working.
Yeah, and that's something we don't have. Like I said, I think I had one that was a situation that was reported to me that the mom wanted the baby to go, but it was handled, it was fine. I mean, we're not seeing that.
Good. So I see Karen on now too. So before we move on to St. Anthony's, does anybody have any questions for Carrie? I think I have everybody unmuted. So feel free.
And I don't know if Mary wants to add anything. I think she's on if she wants to add anything.
Ask Mary. Yeah, if Mary has anything to.
One thing I was thinking of when Carrie was mentioning staffing is that we did get really, really short of staff when we added on some other things in our department. And so one of the things I used in my proposal to be able to get more positions was that if we didn't get more positions, we would have to go back to our old standard of care, putting babies back in the nursery. And I think that really got the attention of administration. And I was actually able to get 3 positions and hoping to get 2 more. So it made a difference to be able to add that to my proposal, because we just couldn't figure out how to, make the numbers work and keep doing what we were doing. And so that was really helpful. It was really hard because Carrie was such a champion for our department, for her to be in the other role. But I have to tell you, if she wasn't still helping us, we would be in all kinds of trouble. So I'm thankful to Carrie, and, we're trying to get back on our feet after our new electronic health record. And we're just now we've been doing it for 2 years, and just now really been able to figure out what changes we need to make in that system to be able to pull this data automatically. So we're hoping, you know, over this next year with our next upgrade, we can have some of this automated, and that'll really help us.
Right. So one takeaway I hear from y'all too is, I mean, everybody that's currently working on baby friendly knows how important it is to have your baby friendly lead, task force chair, whatever, your baby friendly champion, but it sounds like you still need to have that person in place after you get designated as well to help maintain.
This can be a full-time job. Just this right here. Yep.
All right. Well, thank you, ladies. So back to Angela, and I think Karen's on now. Y'all feel ready to tackle your slides?
Yes.
All right. So if you want to introduce yourselves, I know Angela did, and then Karen's on. You want to introduce yourself, Karen?
Hi, I'm Karen Blackburn, lactation consultant at St.
Right. So you ladies take it away. I'll get you on your first slide, hospital characteristics.
Okay, we do about 1,100 deliveries a year. Some years it's a little bit less. Some years it's up to about 1,400. So it does vary. We do have about 60 nurses and support staff. We also included in some of that education. And then while we don't have as many physicians as some of the larger hospitals, we do have quite a few residents as well. We have one full-time lactation consultant, and with our opening of the level 2 NICU in November, hopefully November 1st, we are adding a second full-time lactation consultant. She starts next week. We're very excited about that.
Yay.
We did it. Yay. Oh, we will really enjoy that, I think. We achieved baby-friendly designation. We had our visit in late October and got our letter a couple weeks later in November of 2016.
I would say 4 weeks later, Angela, and for everyone else that's on here, that's like the fastest we've ever that I'm aware of. So
yeah, I don't quite remember. I think I've
like
blocked some of that out.
Unexpectedly quick, yes. All right, successes.
So one of the things we kind of waited, and this will be in my things we would do differently, to really look at some of our things with audits. And it's so challenging to maintain this level of, just engagement with this project when you've been doing it a long time. And hopefully we're not the only ones that struggle with that. I think what she said in the last session, really trying to maintain this and continuing to have meetings would be really helpful. So we got worried early summer. Oh my gosh, we don't know where we are. We went ahead and did audits on all of our steps, even though, we really only needed to do a few of them for their requirements. And I was actually really surprised, and I don't know why, but I really worried staff would just get through designation and forget things. And with our step 2 audits, they did fantastic. Even our physicians did really well. And so we were really excited. Like, this really does start to stick. And sometimes especially in dissemination and moving towards your designation visit, it feels like people are never going to get it, and you're never going to get your staff audits where you want them to be. And eventually that really is maintaining well. We're still doing really well with rooming in. And I didn't put skin to skin on here, but our skin to skin, the nurses love that. And it was a hard sell at first, 4 years ago, but we don't even have to think about it. They do such a great job. And so I didn't put that on here, but that's another success. And then alternate nipple use, I actually thought we might kind of backslide when we weren't tracking it as well. And we've done really well with that as well.
So what do you think made the difference for the nurses with the skin to skin when you said it was kind of a hard sell at first?
Been in this process since late 2012, which feels like a long time. It is a long time. So initially that first year or so, we struggled to get where we wanted to be. And even 2 years later, sometimes we struggled. Now that we're 4 or 5 years in, it's a lot more of a routine, and the nurses have seen so many benefits from it. We even saw a reduction in our special care nursery admissions. They saw a difference in breastfeeding. They started like, okay, don't take my baby. I want that baby skin to skin. And even our pediatricians who, had a hard time with it, about a year and a half after we started doing skin to skin right after delivery, I had a physician who really didn't like it at first say, well, put that baby skin to skin and call me in an hour unless something changes. And my jaw dropped. But eventually these benefits. And instead of rushing the baby off to be monitored in the nursery, she said, put it on a pulse ox and stick it skin to skin and let's see what happens. And of course, the baby did great. So, it really was amazing to watch that. And then now, I don't think that if we said, hey, we're going to stop skin to skin, that people would even want to do that. They would fight back because they love it.
Good. Excellent. All right. Challenges?
One of our biggest challenges prior to designation, we made it with designation. I felt like that was amazing. And then I know if I do audits, we're going to struggle is with our prenatal education in our clinics. It's just really keeping that up where the patients are going to be able to, come up with that information where we've done well enough with it, that they can, that they know it, that they're comfortable with it, that the staff changes and that some of that turnover makes this really challenging. We haven't been in the clinics this year since our designation. And so, I can check in, but it's not the same as how much we were in there before. And so I worry, what we need to do. And we have a plan in place that we're going to work on in the first of the year to really start to work to see what changes we can make with our process that we have so far. That's probably, I think we'll have some other challenges, I'm sure, but I think that one's our biggest one. I think another challenge that I didn't put on here is maintaining some of the auditing and engagement with people with certain things that we have struggled with, so that we kind of keep a tab on where we are. And that's been really challenging this year to try to figure out what's going to work in a more long-term fashion versus what we were doing before designation, which was like 90% baby friendly. You can't maintain that forever. We have other stuff going on. And I think that's been a really big challenge in our first year after designation.
All right. So what would you do differently? What have you learned?
Baby Friendly has this maintenance or quality improvement that they have us focus on. So, this is our first year. We had certain steps to focus on, but we also tried to maintain an awareness of our other steps. And that's been a challenge because it's a lot. And we, kind of thinking about what to anticipate for next year to make sure, we're not really surprised at what they want us to turn in, and then maybe we're not where we want to be. And that has been really challenging. And I know I already said that, just maintaining all of these pieces and having the time to do all of the other things that are going on and maintain this as well. So I think, we have a limited number of people that we're using for that. And then I was out most of the summer with unexpected surgery, and that threw the whole plan off. And then the challenge fell on just a few people. And I think widening that maintenance team that we have is one of the things that we're going to be doing differently. To have that more manageable maintenance audit and QI process here, we just need more people. 1 or 2 people is not enough.
Well, and that's a good point. If it's kind of mainly on one person's desk, then if they're out for any reason, then it's not.
I mean, if it's, like 2 or even 2 or 3 people, we're so busy. We have a lot of things happening, and even 3 people sometimes doesn't feel like enough. And so widening that just a little bit, which is what we did late summer, is widen that net a little bit, and that enabled us to get where we wanted to be and send in our stuff on time.
Right. So one other question, just looking down the road with your level 2 NICU opening up next month, do you see any challenges on the horizon with that? Just curious, yeah.
Yes, I do actually, and I'm sure Karen shares that as well. We're bringing in NICU nurses, so it's all people with level 2, level 3, or level 4 NICU experience. And that's a different mindset when we look at infant feeding and those babies are sick, but we're still wanting to maintain that awareness. It is, still a level 2 nursery, and, making sure that we try to, save our breastfeeding as much as we can and not just get into, well, every baby needs a bottle because they're sick, or, that mentality maybe. Hopefully we won't. We are actually going to still require all of our NICU nurses to do the 15 hours of education as a baseline, as we transition babies from the NICU back to mom, and making sure we're doing those things that we can to maintain breastfeeding through that experience. We'll just have to kind of see. We're getting another lactation consultant to help manage in the NICU with moms as well, so that we provide the right level of support for them.
Excellent. All right, does anybody else have any questions for Angela, or Karen have anything to add?
Yeah, Becky, this is Karen. I agree with everything. You know, I was on jury duty Monday and thought I might be on it all week. So, Angela, thank you for doing the slides, because we weren't even sure that I was going to be here. So I had just written a couple of notes. Most of it Angela already said. You know, mainly I had written, you know, don't assume anything. Don't assume that prenatal clinics are going to continue, you know, doing what you wanted them to do. You know, constantly staying in touch with these people, you know, constantly calling, constantly sending emails. You know, I would send out emails periodically, you know, to kind of the managers of those locations. You know, you guys are still handing out those brochures, right? You know, and so did Angela. I mean, we stayed in touch with them all the time. And I think you just have to do that, because you know, occasionally it's like, oh yeah, we did run out of those, you know, and you're like, well, that wasn't just a one-time thing. You know, this is a forever and always. We're doing this now forever. So it's just kind of, you just have to keep talking to them, keep it always going, constant follow-up with them. Until they really kind of get that this isn't just for a few months until these people come. This is what we do all the time now. So I think it's just, you know, again, not assuming anything. It's constant follow-up, constant education with your staff. Same thing. We were in full-blown, you know, constant education, constant reminders, constant things. And it does. You guys that are working on it, you know, it's like she said, it's a full-time job. It takes over your life for a while. And I think that's the other thing is once they come and once you find out you get your designation, you've been on this role for a few years. It does kind of feel like all of a sudden life changes a little bit and you sort of lose your momentum, sort of switches, or it felt like that for me. In a way, it's like this relief, like we did it, you're excited and you did it, but then that momentum that was driving you, it kind of goes away because that pressure is off of you. But that's kind of a bad thing too, because that pressure is off of you. So you have to keep, you know, find that and keep going and not let it go, because it can go away for your staff, it can go away for your prenatal clinics, and it can go away for yourself. And you know, if you're not careful, you can start letting things slide. And so it's just like Angela said, you know, finding the time to like look ahead and what's coming up and what are they going to expect out of us next year, and you know, what's the QI project's going to be that we're going to have to work on, and not getting too, you know, slack on things, because you can, you know, before long, if you don't stay on top of it, things can start to slide back again. So you do have to kind of keep things at the forefront and keep communicating with your staff and with all the players involved. And if there's one thing, just like Angela said, you have got to recruit a bigger team. Recruit as many people as you can to be on your team, because I promise you, as the time goes by, you're going to have people that will start out helping, and then something will happen, and they, you know, they get busy, and they can't participate anymore. We had people, Angela will tell you, you know, they started out really involved, and then they just got busy and kind of, you know, now they can't come to meetings anymore. Now they can't help. You have people kind of in and out helping, but it cannot come down to just one or two people. It just can't, because you cannot keep up with all of this. And I would say, I mean, the more people you can get involved and divide up these tasks, because to maintain it, you're just going to have a huge army of people to work on it, or it's just too overwhelming, you know. One thing real quickly, I don't want to, sorry, go ahead. One thing I was going to say real quickly, because I know we need to move on, about the NICU stuff. I have been really pleased with the response of Dr. Ernst. She's going to be our medical director, the neonatologist, and the nurse practitioners, which I think there's, good grief, let's see what the list is here. I mean, there's like 15 of them. I put out one request to them that they do, you know, the 3-hour thing, and I've already got certificates. I think I've only got 3 left that haven't completed it. They were all very quick to do that, and so I've been very impressed.
Awesome.
Yeah, and Dr.
Great.
Ernst has sent me everybody's certificates as they have got the physician education done. So I really feel like that's going to help them get on board with this. You know, I know things are going to be different in the NICU, and it's not always going to be perfect, but I felt like that was a big start, that we had our new nurse manager. That's the first thing, you know, what can I do to get on board with this? And then we've had all of these neonatologists and nurse practitioners sending me their breastfeeding education certificate. So I really feel like that's a really good start for us, you know?
That's exciting to hear.
I'm really happy about that. Yeah, really happy about that. So,
yeah.
Okay.
So thank you so much. I'm gonna wait to see where my order is now. I know we'll go to Kate last because we'll do Vicki and Integris. So Vicki, I know you were on. Are you ready?
Yes, I am.
So you want to introduce yourself?
My name is Vicki Harder. I'm the clinical nurse manager of the mother-baby unit at Baptist Hospital in Oklahoma City.
All right. So let me move on. Hold on. There we go. Okay. So hospital characteristics. Take it from here.
We do around 230 deliveries per month. Because we've been working on QI and we've had to divide everything out, I guess I got more anal about this. We have, because this is how we had to report it to Baby Friendly. We have 66 LDR nurses and neonatal transition nurses and 43 nurses in the mother-baby unit. When we became designated, we only had to require that physicians received education that were affiliated with the hospital. In 2018, it'll be with privileges, so I had to report both ways. So we have a total of 39 OB doctors with privileges, 29 pediatricians. I think 7 of those are neonatologists that are work here at the hospital, 9 family practice, and 9 advanced practice nurses. Our mother-baby lactation team, we have 5 nurses. 3 of those are certified, 2 are working on that. NICU has 2 lactation consultants of their own that are RNs, and one of our neonatologists actually just passed his certification. So that's kind of cool.
Oh, who's that?
Dr. Hannah.
Huh, awesome.
And we were designated in January of 2015.
Okay. All right, successes.
After listening to everybody, I think talking about, you know, hardwiring, the things that we've been successful in, we've made a point of hardwiring into our daily practice. So training all healthcare staff, our nurses, we've worked, you know, extensively with our clinical education department, and they help make sure that all the nurses get enrolled in the 15 hours of classes. We have a quarterly education plan. Our lactation consultants on mother-baby do our audits for us, and we try to audit 55 patients per month. They divide it up between the 5 of them. And so we've got a pretty good idea, you know, month to month what we need to work on, plus based on the QI, we figure in our quarterly education plan based on that. So that works well. Rooming in, there was this, you know, the pediatricians in the beginning didn't trust us because some of us, you know, we were labor and delivery nurses. I myself was a GYN nurse, and they just didn't trust us with the babies, and every baby needed to go into the nursery for transition. So out of that, our clinical director helped develop the neonatal transition role, which is nurses with either long-term newborn nurses or NICU nurses, and they're able to transition the babies at the bedside. So if they have low blood glucose and it's treatable with glucose gel, we can do that at the bedside. They can do NeoPuff at the bedside. And we've really kept a lot of babies even out of the level 3 NICU by having that program. So that's been great.
Wow.
Foster the establishment, taking care of our moms after discharge from the hospital. So Oklahoma, especially the metro area, we can go to the COBA site and there's just tons of resources, and we give those to our mothers or with well babies, term babies, when they go home.
Family time, a time for conversation and laughter. Turn off the electronics and enjoy your family without all the distractions.
Vicki?
Yeah, I'm here.
Okay. Somebody else must have put us
Breastfeeding provides
on
many
hold.
benefits for you and your child. It
Said it
gives
at the
your child
beginning.
nourishment, but can
I
also
can-
help protect your baby from many things
you
like
just try to
allergies,
speak over that?
diabetes,
I
and
will.
other ailments.
For our
Breastfeeding,
babies,
sorry.
Breastfeed your child.
for a
The
higher
benefits are
risk level
enormous.
of 70 of our babies per month. Babies.
Vicki, you're cutting out some now.
Are you normally a fast eater? Did you know that it takes 20 minutes for your brain to know that your body is getting food and that you are full? When your brain gets this message,
All right.
Can you hear me?
hungry. So,
Yeah, I
if
can
you're
hear
a fast
you.
eater, slow down and give your brain a chance.
We wanted to
catch
make
up
sure
your
we had a
stomach. Take
safety
care of your
net
eating
for our
habits and take
at-risk
time
babies
to
to
enjoy
make
your
sure that they're followed up, out baby friendly at rest. So our lactation nurse, we have a risk assessment that we do for all babies, and then if they meet a certain level of that risk assessment or acuity scale, then the lactation nurse breastfeeding be sure to schedule an outpatient
for a mammogram. Because
appointment.
what seems like an
We
inconvenience
learned all that from Karen Blackburn and from you, Becky, for your acuity.
Yeah. Oh, I'm so sorry about the background noise. So, yeah,
our
and I don't know if
baby-friendly
anybody-
team has made us successful too. We started with the baby-friendly team, which has turned newborn quality team, which is just so they were able to work on our policy, and that was a huge help. So having those additional resources within our own hospital with our system has.
And reinvent your life as someone who doesn't use tobacco.
All right.
If you need help quitting, call
let's see.
1-800
So,
quit now. Or talk to your
challenges?
primary healthcare provider about free nicotine
That y'all have
replacement.
safe?
The first step.
Yeah,
is
step
deciding to quit.
2 was a
Dang it.
challenge with.
Oh, yeah.
Every day you have opportunities.
So somebody's put us on hold, and we're getting their music, which is unfortunate. Oh, yeah, now it's maybe gone away. All right, so everybody that's on the phone, please don't put us on hold. You can put yourself on mute if you need to do something, but don't put the call on hold. So, all right, Vicki, are you
Yeah. Our challenge really all stem from, I would say, physician education. We're successful at getting all our nursing staff trained, but we're not so successful. We don't have physician education hardwired. And because we don't have physician education hardwired, we don't do as well at prenatal education, step 3. On step 6, we go through periods of increased supplementation, and they want bottles and pacifiers. So we know that those are all steps that we definitely need to work on, but starting with step 2 is going to be, I think will solve the other 3. Our administrative staff, they make rounds and they look at our data boards and they asked what they could do to help us, and I said help with physician education, and they've said that they're committed to doing that. So that's we're going to have their help and come up with a plan for physician education. Step 6, giving infants no food or drink other than breast milk unless medically indicated. We do quite a bit of formula supplementation because of that, and so we're working on establishing a donor milk program for our mother-baby population. They do use donor milk in NICU, but right now we're not using a mother-baby. We're just held up in the policy stage of that right now.
okay? Anything you need to help the policy stage?
Oh, when you work in a big hospital like this,
moving it from one email to another.
infection control gets involved, environmental health gets involved, so you end up dealing with a whole lot of other departments. So I've forwarded the information that you've already sent me to them. I just haven't heard anything back since the day I forwarded, which was the day you sent it to me. So hopefully
it gets parked on somebody's desk, low priority. Right. So, all right. So one thing you would do differently
would just again be that focus on physician education from the very, if I knew what I knew, if I knew now what I, if I knew then what I do now, it would be all focused on physician education. Trying to figure that out from the very beginning, because if everyone doesn't have the education, you're just really kind of stuck in certain areas.
Right. Now I know, anyone that's on that has any questions for Vicki? And I know Evelyn is on from another sister Integris hospital that's also baby friendly, Integris Health Edmond. So Evelyn, anything, I know yours is a little smaller facility, but anything you would add or agree with that Vicki has covered?
Well, Vicki and I have been working closely these last few weeks trying to get all our stuff ready to turn in and trying to share information as far as physician education. But I would agree with her that has been difficult and wish we would have focused a little bit more on that. In addition, we kind of had a setback in our staff education process, which kind of threw us off a little bit, and then we transitioned to a new EMR, so that set us back. So just trying to get all of our people caught back up and getting them re-educated or getting their 15 hours up to speed in a timely manner. So just trying to get that back on track. I agree with a lot of the things that everybody else has said. Keeping a group, and maintaining, that's been another issue, because the group I had in the beginning, several of those people have since moved out of state. And so just trying to get people back on board to be supportive. I mean, I think the staff are all, when we did our audits of the staff, they all responded appropriately. It's just, and my lactation consultant, bless her heart, Becky Drevitz, does a lot of my chart audits for me. We're not as big as Baptist, so it's a little easier for us. But anyway, so I think just trying to get the physicians, getting their education completed in a timely manner, staff completed in a timely manner, and then just keeping the momentum going. I agree with what Angela said earlier in the clinics. I do have concerns that there's been a lot of turnover there, and that things maybe not going as smoothly as we thought they had, or as they had been prior. So that's our next focus, they've had a change in their clinic manager and staff. So that's our next focus, to go over there and get back on track with that group as well. Because with our new EMR, we're hoping there's a way that there can be some documentation in the EMR that they've received the education in the clinic, so that we can see that without having them to have to do a paper format.
Right. So on that note, that kind of makes me think of a question that we had when Karen and Angela from St. Anthony's were speaking about kind of trying to keep frequent reminders and contacts with the clinic staff. Is that well received when you're trying to follow up after designation and, hey, are we still doing this? And does that feel like that's working okay as far as trying to maintain that communication and encouragement?
I think initially it was. I think we just haven't had the time to be able to do as much follow-up with them. So honestly, not sure with this new manager and stuff. Our previous one was very on board and no problems whatsoever. So I'm just hoping this new person is going to be just as on board.
Right. And that's the challenge too, just when you have staff changes and then it's another education process
right.
for somebody that's in a new role. Angela or Karen, any other, did you get pretty good positive response as you're trying to, constantly, gently encourage your clinic folks?
I think we have. Yes.
Yeah.
Go ahead. Yeah. And
go ahead, Karen.
At the prenatal clinic seem to, the main managers have seemed to be pretty steady, don't you think, Angela? We've had a little bit of turnover, maybe at one I can think of, but the general people have seemed to be pretty steady.
Okay. And then there's, so back to maybe Vicki at Integris Baptist. Here's a question from Ruth about Best Fed Beginnings. Are there modifications of Best Fed Beginnings materials that would have been helpful? And I'm not as far, oh, excuse me, let me go back. She actually had a first question. Did Best Fed Beginnings have anything to offer about healthcare provider education, that physician provider piece?
Well, I mean, yeah, they were wonderful. I don't know that I could have made it through without their guidance through all of the 10 steps. And they stressed education, but you know, when you work in a busy hospital and you have so many different things going on, you know, we tended to narrow in on the have-tos, which was affiliated physicians at the time. And you know, right. And in 2 years, your physician staff changes and office staff changes. So, you know, we tend to play whack-a-mole around here. You go after what you have to on any given day. So, Best Fed Beginnings was great, but at the time, yeah, and I certainly attribute our our being able to become baby friendly to them, a large part to them.
So, but yeah, did they I don't think they actually provided any type of education modules. That's more the guidance on, right?
For physicians specifically? I mean, no, well, there were like 90 hospitals participating, and they didn't really, what they did was we created, you know, systems where we could contact each other, and we would present what we were doing, and we would steal, I think, they had a motto about, you know, stealing, I can't remember how it went now, but, you know, be sure and share, be sure and steal what you could from other people. So that's how it was.
Right.
The physician education that we're putting out and encouraging our physicians to do are the free education modules that are out there from Massachusetts and places like that.
Right. Yeah, we have a couple of those. Well, as somebody was asking me earlier this week, that were on our website and apparently got deleted. So we are finding those, and those links will be back up on our website under training. So we'll certainly remind everyone or kind of send that out and make sure everybody knows how to find that. So what we try to do is we know of resources that are out there that are easily accessible to help identify that and put that on our website. So, all right. Well, we have a few more minutes here, and I'm going to move on to Comanche County. So Kate Copas is the lactation consultant at Comanche County Memorial Hospital in Lawton, and they had something going on today, like a community baby shower or something, that they weren't going to be able to be on the call, but she graciously, put together some slides and sent them to me. So, our friends down in Lawton, as you see, do around 120 to 140 deliveries a month. Have over 60 nurses in the maternal newborn areas. They have, a good complement of, as you can see, 7 OBGYNs, 6 pediatricians, and 7 family practice physicians, plus some residents as well. And then they have 1 full-time IBCLC, 1 part-time IBCLC, and they do inpatient rounds, also staff an outpatient clinic. And then they have 2 part-time nurses that also do some inpatient lactation rounds. And they received their designation in the fall of 2015. So, and what Kate said were some of their successes, that they're, since they've been designated, as the others have mentioned, that each year there are annual quality improvement audits that Baby Friendly USA assigns to the hospital to complete. So they passed their first year 2016 quality improvement audits. They started using pasteurized donor milk from the Oklahoma Mother's Milk Bank for both their level 2 NICU and some on the postpartum floor. So those Step 6, exclusive breastfeeding when they have the medically indicated situations, which sounds like Integris Baptist is hoping also to implement. They increased their lactation team members, and oh my gosh, their MPINK score for 2015 was 95, so 95 out of 100, that's awesome. And for those of you that might not be familiar with that acronym, that's the survey that the CDC, the Centers for Disease Control, does every other year of all birthing hospitals to assess its maternity practices in infant nutrition and care. So, and it's really a good, it's a self-assessment of kind of all the multiple steps of the 10 steps in the baby friendly, but they also ask, you know, a few other things as well, but 95 out of 100 is an awesome score on that. Just a side note on MPINK, those of you that have been participating in it each year, the CDC didn't do a 2017 survey. They are actually revamping MPINK, and a new version, kind of MPINK 2, will be launched in 2018. So as soon as we hear, you know, of that starting to go out, we'll definitely alert everybody to that. So anyway, some of the challenges. This sounds familiar, that they lost some of their baby-friendly team members, and they had a good interdisciplinary team. Trying to get new physicians to do some of the mandatory training has been a challenge. Documenting skin-to-skin and formula teaching, educating on for the formula feeding families. Of course, education about why to avoid bottle nipples and pacifiers early on until breastfeeding is well established. That's step 9. And then they have, sounds like a new pediatrician who's not upholding the World Health Organization code and is giving out free formula samples in their clinic. So, and technically baby friendly wouldn't go and assess a pediatrician's office, but that certainly is frustrating to see that happening. And then the last challenge she had was just to maintain the culture change with the nursing staff and help them, you know, stay positive about baby friendly and what that means. So, and one thing she said things they would do differently, that she would continue to have the interdisciplinary team meet at least every other month or every 3 months, so to maintain that momentum after designation, to keep up to date on development that staff training documentation tool that Baby Friendly USA provides, so they can make sure they're keeping all their staff trained, and then keep the administration up to date on physician challenges. So it sounds like that's an idea some of our other speakers today have had as well, is call in some reinforcements to help you with your physicians who can be a little too independent-minded perhaps at times, huh? So thanks to Kate for sending those in when she wasn't able to be here. And let me just see if there's any other questions. We're getting near the end of our hour here, and I'm just going to put one last slide up here to just remind everyone that our 6th annual Becoming Baby Friendly in Oklahoma Summit is scheduled for Friday, March 2nd. At the Samus Center, where it's been each year. And we're excited about our 2 speakers that we have this year. Dr. Sahira Long is a pediatrician from the Washington, D.C. area and has been active in her D.C. Breastfeeding Coalition. She has done a lot to address disparities in breastfeeding in the African American population and that community support piece. So she'll be speaking on some of those issues. And for those of you that have been to some of the trainings that I offer, and when I've shown some of the videos from the Office of Women's Health and the one especially that talks about misconceptions and shows all the African American moms, well, she's in that video. She's the pediatrician mom that spoke in that video. Of course, her hair looks a lot different now, but she's never been to Oklahoma, so we will be excited to have her here. And then Tina Smiley is a physician. Both of these are MD IBCLCs, also a pediatrician, and she's the one who has done a lot has a great DVD out there about baby-led breastfeeding, and she's going to really talk about the neurophysiology of breastfeeding and kind of how it impacts, you know, the baby with position and latch, and then of course the mother-baby diet. So she's got a couple of talks related to that that'll kind of be that more hands-on clinical application piece as well. So hopefully a good combination there. But otherwise, I think I'll just see, does anyone else have any other announcements or things coming up or questions?
Becky, this is Charlie. I had sent
Charlie, we're glad to hear from you.
Thank you. I'd sent an email or called. I'm having problems. I thought somebody had mentioned earlier. I'm trying to send the link for the physicians to get their education done, and I can't find it.
Yeah, I did talk about that when you emailed. Okay. Then I thought, well, let me go find it, and I'm just going to send it to you, and then I couldn't find it.
Okay.
So in some of our staff transitions, some things got deleted off of our website. So we are actually in the process of resurrecting that. And as soon as we get those links back up, we'll send that out to everybody, but we'll definitely send it to you as well. That just got lost. I'm glad you asked because I wouldn't have noticed that. So, oh, and Ruth is just saying to remind everybody that the last quarterly meeting of COBA, and some of you who are familiar with COBA, that's our Coalition of Oklahoma Breastfeeding Advocates, so our state breastfeeding coalition, is meeting October 21st. That's a Saturday, a couple of weeks from now, at the Stevenson Cancer Center. So that's the general COBA meeting, which and at 12 noon. Thanks, Ruth. So we encourage everyone, if you haven't been to a COBA meeting, this would be a good opportunity, and look forward to seeing you there. So, any other questions or anything? And we are just here at 1 o'clock. So, as always, we will send the slides out by email, and I usually record this and somehow